Good morning all. I am Dr. Anand, consultant pulmonologist, Medicover Hospital, Pune.
Good morning, sir.
Morning.
So we would like to ask you a few questions regarding tuberculosis awareness.
Okay.
So the first question is, what is tuberculosis?
Tuberculosis is a mycobacterium tuberculosis infection which is spread by aerosol routes and coughing and spitting by infected people on the road. It is completely preventable and treatable disease, but the mortality is very high with tuberculosis. It is more than 18%, which is commonly observed in India. And the incidence, that is new cases found in India are per yearly more than 5 lakhs people are diagnosed with active tuberculosis. And the prevalence of means how many patients are there at a time in India is more than 30%. That is the danger and most prevalent disease in India.
Okay, going on to the next question, how is TB transmitted?
TB is transmitted by aerosol route. Aerosol route means whenever patients spit or cough or talk or loudly talk or laugh, there are few drops are made by cough droplets, which if the patient individual ingest or inhale that particles, then tuberculosis gets spread. And if the patients are immunocompromised, just like TB or HIV or these are uncontrolled diseases, then these patients are more prevalent to get an active infection in this part.
The next question is, what are the symptoms of tuberculosis?
Symptoms depend on which organ is infected in the TB. Most commonly we know the lung TB, which have symptoms of cough, breathlessness, hemoptysis. Hemoptysis means blood in sputum. There is anorexia, means there is no appetite. The patient have reduced appetite, and there is a weight loss in many cases. If the other organs are infected with TB, just like abdominal organs, then patients can have abdominal pain, or they have weight reduction, fever, and the symptoms are vary according to each organ which is involved.
So the next question will be, how is tuberculosis diagnosed?
To diagnose tuberculosis, the gold standard test is to make a sputum ZN stain, that is AFB stain, and a culture of AFB bacillus. The new molecular methods are also available, that is cartilage-based nucleic acid amplification test, that is detection of genes of tubercular mycobacterium in the sputum or given sample. The gold standard is sputum, but other tests are also available, which are X-ray. We have to do X-ray of these patients if patients have cough and respiratory symptoms. We can do a CT scan also for early cases, and we can diagnose TB accordingly.
So moving on to the next question, which is very common among the common people, is TB treatable?
Yes, definitely. TB is completely treatable if you come early to physician and get diagnosed as early as possible. It's a completely treatable and preventable disease. We can treat the TB on tablets only. There is no need of hospitalization of more prolonged days, or there are no difficult tests we have to perform. You have to concentrate on your symptoms, just like a cough, breathlessness, weight loss, fever, anorexia, and we can do X-ray tests, CT scans, sputum tests, and we can treat TB completely. This is completely treatable and curable disease.
So the next question will be, which part of the population is at risk of TB?
In developing countries, just like in India, every population is at risk of developing TB. But the TB is more prevalent in the diseases which are chronic in nature, just like diabetes mellitus, if is uncontrolled, then patients are more prevalent to develop TB. HIV patient, malnourished patients, the patient is low socioeconomic status, which have poor ventilated areas, poor populated areas. These patients are more prevalent to develop a TB.
So the next question is, can TB be cured?
Yes, definitely TB is definitely curable disease. If you diagnose early, the complications are also very less, and you can treat the TB according to the categories, category 1, 3, 4, 5, and we can treat TB on the tablets only.
So moving on to the next question, which is TB contagious?
Yes, TB is definitely contagious. That's why patients, active cases, should have cough etiquettes. They not spit on the road. They should cover their mouth while coughing. I will demonstrate how to cover your mouth. You can cover your mouth just like this, but many of the times your hands are busy in doing some work. Then you can cover the mouth like this only. Or you should use, if you diagnose with TB, then you should use mask, 3-ply mask or common cotton mask, which are available. And TB is also preventable by maintaining active lifestyle, controlling your chronic diseases, and by diagnosing the TB early and get treated as well, that prevent the spread of TB in society.
So we would like to end this interview with the last question. How can tuberculosis be controlled?
To control tuberculosis, there is a revised national tuberculosis program is there. They are doing screening of active suspected case or target case finding is also there. We have to diagnose the cases early. You have to identify your symptoms as early as possible. You have to get tested for the TB, which are easy tests, which are sputum tests, X-ray and CT. We can do on OPD basis as well. And we have to maintain the active lifestyle to control your chronic diseases and get ventilated areas at home as well, because ventilation is also most important. The overcrowded population have more prevalence to develop TB. That's why we can prevent the TB by doing all these methods, and definitely we can end the TB by social and preventive social activities and all the things. Thank you.